Hi, I'm Eirik Salvesen from Årets Dental in Norway. I'll share some experience from the COVID-19 situation in Norway. So the whole part of communication towards the patients was about safety. And we needed to communicate its safety for the staff and its safety for them as patients. So information for the patients is given in several steps. We are using the SMS services with a link to our website, which are giving even more information on how to arrive the office at specific time, what to expect. One of the informations that we have is that we will not be shaking your hand, but we will still be happy to see you. We will also look a little bit different than what we're used to. We will have more of the protection equipment even at the time at the waiting area. But in this specific situation, we are using the protection equipment at all time that we are meeting the patients, from outside the door to the waiting area to the treatment room and out again. It's at close down, we needed to inform the patients that the appointments were cancelled. That we did the first days by calling everybody and making sure that they knew that we would be recalling them back as soon as we were able to open again. The coming weeks we used text messages and emails to communicate with them. As we moved on to the reopening of the clinics, we made sure that all the patients that we put up for appointment was called personal by the doctor responsible for it, giving them enough information, making them sure that they were to be kept safe within our office, and making also sure that we were screening all the patients. So everybody was screened for the normal questions about having a fever, being hospitalized, or even in quarantine at the time before they were accepted for an appointment. We also made sure to tell our patients that we have the routines, we reinforced the routines, and probably the safest place to be right now is in our office. Call each and every one of them to give them also the safety, but also the instructions on how to get to the office, and please stay out of the waiting room, wait on the outside if it's possible, show up right on time. We're going to be on time, but you don't have to be before your appointment because we don't want the gathering of people at the waiting area or outside. When patients are informed about getting an appointment in our office, they're always now instructed, even on the social media and websites and by phone, they need to contact us either by telephone or email before. So no showing up at the office at this time.